Sociopath. Patients with narcissist, borderline, and bipolar disorders. Written by Lucy Hiltz, John Kirschen, Matt Belster, Victor Higgins, and Taylor Hench. Narrated by Lily Northfield, Sarah Owens, Oskar Gundersen, J.A. Lydick, and Rory Young.
Bipolar disorder, the relationship between schizophrenia, depression, suicide, and personality disorders. Written by Lucy Hiltz. Narrated by Lily Northfield. Chapter 1. Bothersome Idea. About 1% of our population struggles with bipolar affective disorder. Individuals with this disorder experience pretty bad episodes of both unhappiness and mania, can last for weeks to years. Manic symptoms are remarkable and disruptive, and typically consist of elevated or irritable state of mind, unsuitable self-esteem, grandiosity, significantly decreased need for sleep, excessive energy, hypertalkativeness, usually with fast and uninterruptible speech, and very bad judgment, typically including sexual behaviors or financial choices. Psychotic signs and that include auditory and visual hallucinations and delusional thinking, such as believing that one is God, are really common and disruptive. Unattended, this illness severely impairs function and can cause impairment and death. Most, but not all, clients with bipolar I disorder respond well to presently readily available treatments. Patients are typically treated with medications together with education and corrective treatments. Another type of bipolar affective disorder is called bipolar II disorder. Individuals with this disorder show elevated mood and/or irritation unless, perhaps 3 or 4 of the above signs, which might last for only several days or might be consistent. Importantly, signs represent an obvious change from a person's typical behavior and trigger considerable distress and disability, but generally not to the degree that happens in bipolar I disorder. Psychotic symptoms are missing. Clinically, bipolar II disorder seems to be a close relative to bipolar I disorder. Even though there aren't a lot of well-designed treatment trials, most psychiatrists deal with clients experiencing bipolar II disorder with approaches similar to those used in the treatment of bipolar I disorder. Current studies have extended the idea of bipolar affective disorder to include a diagnosis of subthreshold bipolar illness. This condition is variably described as consisting of mild forms of 1 or 2 of the above behaviors, lasting for a variable, at times undefined, time period. For example, an individual could show increased talkativeness or irritability, show slightly raised self-confidence, or experience more energy than normal for.
Sample complete. Ready to continue?